Today, let's discuss the topic technique of massage for the limbs, back and neck. So let's start with the introduction. Massage involves working and acting on the body with pressure, structure, unstructured, stationary or moving, tension, motion or vibration done manually or with mechanical edge. Massage can be applied with the hands, fingers, elbow, knees, forearm, feet or a massage device. Depending on the application and technique used, massage is used to promote relaxation and well-being and is beneficial in treating sport injuries and other problems affecting the musculature of the body such as postural malalignment and many painful conditions. So here comes the massage for the upper limb. First we have preparation of the patient. Ask the patient to remove all clothes from the appropriate arm and shoulder. Shoulder straps should also be slipped off. Stand in work standing just beyond the patient finger tips with outer leg forward. Treatment of upper limb. Effuras. Here comes the effuras of the whole limb. The effuras to the upper limb is usually performed with one hand at a time while the other hand controls both the stability of the limb and the position of the hand. The grasp on the hand should be with the palm curved so that it obtains a contact with only palmar margin to avoid sticky grabs. The effuras of the extensor aspect of the arm. One hand grabs the patient hand in mid-prone position and the other hand starts effuras under the little finger and proceeds up to the ulnar border of the forearm and middle surface of the arm to the axilla. Here comes the effuras of the flexor aspect of the arm. One hand grabs the patient hand in mid-prone position and other hand starts from the thumb over the lateral border of the forearm and lateral surface of the arm to the axilla. Turn the palm into more supination and take the stroke again from the palmar aspect over the finger over the front of the forearm and anterior surface of the arm to the axilla. So here comes the kneading. All the kneading manipulation in the upper limb is performed using circling technique. Always be aware that the size of the circle must be related to the size of the area under treatment. The pressure on all the manipulation should be inward towards the center of the arm and with upward pressure so that we can assist the venous blood and lymph flow from distal to the proximal. So next is the double-handed alternate kneading. Double-handed alternate kneading of the upper limb is usually performed straight down the length of the upper limb, from the shoulder to the fingertips. And next is the picking up. Picking up on the upper limb muscle is usually performed with one hand at once and from proximal to distal. The operator's outer hand works on deltoid, tricep and brachioradialis and the inner hand of the bicep brachii and the forearm flexors. The free hand stabilizes the limb adjacent to the working hand. Progress should be in small stages of about 1 to 2 cm at a time. So here comes the muscle shaking. Place the patient limb in the mid-prone position and the bulky muscle like deltoid, tricep, biceps and brachioradialis muscles can be shaken. And one should take care not to bounce on the adjacent muscles. So here comes the muscle rolling. Muscle rolling can be performed on each of the upper limb, which can be picked up, and this manipulation is often easier to perform on brachioradialis than either rigging or picking up. Next is the hacking and clapping. Hacking and clapping are usually performed with the patient's forearm pronated. Start at the posterior axilla and down the posterior part of deltoid, tricep, and then onto the forearm extensors. So here comes the massage to the lower limb. First of all, start with the preparation of the patient. Ask the patient to remove all the clothing below the waist except the brief or pants. Check that the feet are clean and not malodorous. If necessary, ask the patient to wash the feet. So here comes the preparation of the treatment couch. Cover the couch with an underblanket and cotton sheet and fix them in position with straps. Provide 2 pillows for the patient head and either one large pillow to go under both knees. For the treatment of lower limb patient can lie either supine or prone. Treatment of the whole lower limb. So start with the effuras. The effuras of the whole limb. There are 2 methods of working on the foot. First one, each hand start with the fingers over the toes, that on the dorsum transverse to the anterolateral side of the ankle, slightly in front of that on the plantar aspect, which passes in step to the anterior middle side of the ankle. The second one, the alternate methods of working on the foot is only different from the hand on the dorsum. For each stroke, the hand start with the whole hand on the dorsum of the foot, the fingers over the toes, and the palm over the tarsus. For each stroke, the hand start with the whole hand on the dorsum of the foot, the fingers over the toes, and the palm over the tarsus. The heel of the hand is near to the lateral malleolus. The stroke with this hand is initiating by pivoting it with some depth on the dorsum of the foot, so that our finger turn to lie on the outer side of the foot and then proceed. Whichever method used, we must abduct and extend our fingers so that our hands span forwards and sides. Then the front of the leg over the knees and thigh to the femoral triangle, where we should increase our pressure and pause briefly. Second one, kneading. All kneading manipulations on the lower limb are performed using the circular technique with the modification for the size of the area under treatment. The first one, kneading of the thigh. The thigh is usually treated with a double-handed alternate kneading dealing with the medial and lateral aspect together and the anterior and posterior aspect together. Second one, kneading around the knees. Start with both hands on the anterior aspect, of which the heel of the hand touching above the patella. Work down, letting the heel of the hand divides round the patella, and again let the heel of the hand meets again below the patella. Third one, thumb kneading around the patella. Use the maximum length of thumb and work either one thumb on either side or both thumb on each side. Fourth one, fingertip kneading at the knee. Fingertip kneading at the knee, use fingertips to work on each side of the bony area of the knee with thumb resting on the adjacent areas. The fifth one, kneading of the calf muscles. The lower limb may be flexed slightly to give a better access. The sixth one, kneading of the foot. Place the outer hand on the dorsum of the foot with fingers laterally and thumb below the medial malleolus. Third one, we have picking up. Picking up manipulation can be performed in bulky area of thigh and calf muscles. The fourth one is ringing. Each muscle of the thigh and calf muscle can be treated with ringing manipulation separately. The fifth one is the hacking and clapping. Hacking and clapping on the lower limbs are usually performed regionally. Both manipulations can be completed on thigh before proceeding to the calf, follow the petrissage to the thigh before kneading is practiced on the calf. The line of work should go up and down the limb with the hand striking the muscle across their length and so across the long axis of the muscle fibers. Massage of the back. Let's start with the preparation of the patient. Ask the patient to remove all the clothing except brief and pants. So here comes the preparation of the treatment couch. The couch with an under blanket and cotton sheet and fix them in position using straps. If the couch has a nose piece, remove it. If not, place two pillows across one another at right angles at the head of the couch so that the patient's nose can be rested on the crossings. Provide a small pillow under the abdomen and possibly one under the ankle and cover the untreated part. Treatment of the back. So here comes the effuras of the back. The effuras manipulation of the back can be divided into two parts. First one, the lumbar stroke, and second one is the back stroke. So first comes the lumbar stroke. Start with our hand on the middle of the lumbar region and its lowest point and finish at the groin. About 3 strokes should be made each with an upward curve so that the whole lumbar region is treated. And the second one is the back stroke. Starts with our hand in the lumbar region. The first stroke at the side goes to the axilla. The second stroke goes from more central area to the axilla. And the third stroke proceeds up the middle of the back to the supraclavicular area, curving over the middle of the upper fiber of the trapezius. So here comes the kneading, and the first one is the kneading of the back. The pressure is directed towards axilla on the main part of the back and upward and downward direction. The second one is alternate double-handed kneading. The lines of work proceeds downwards from first one just below the axilla to the outside of the buttock. The second one over the scapula to the buttocks. The third one over the superior of the scapula to the buttocks. And third manipulation is single-handed kneading. Single-handed kneading can be performed on any area of the back. The fourth one, superimposed kneading. Superimposed kneading is performed for a greater depth than single-handed work. Fifth one, thumb kneading. The area most often given thumb kneading is the length of the sacrospinalis muscles. And third one is skin rolling. This manipulation is performed by pulling the skin from midline to side by lifting the skin with the thumb and thus reversing the performance. The fourth one, skin ringing. This manipulation is mainly used to mobilize the edema fluid from the back. The fifth one, muscle rolling. Rolling of sacrospinalis is performed one side at a time. Place two thumbs from a straight line and one on the first side are placed to exert pressure outward from between the vertebral spinous process and the middle margin of the first side of sacrospinalis. Sixth one, hacking and clapping. Hacking and clapping on the back is done in 4 lines, that is, to each side of midline and started under the more distal axilla. Hacking manipulation can be applied either across or transverse on the back. The pressure of manipulation varies according to those of soft tissue. So here comes the massage of the neck. So let's start with the preparation of the patient. Ask the patient to unclothe from the hairline to just below the clavicle. There are 4 patient positions for neck massage. First one, patient in prone lying. Second one, patient in supine lying. Third one, patient in side lying. Fourth one is patient in forward one lean sitting. So here comes the treatment of neck massage. So first let's start with the effuras. The neck strokes are performed with the flat of the finger starting on the side of the neck and going to the supraclavicular gland. A second hand stroke down and back of the neck goes down to the same gland, and a third stroke goes down the back and side of the neck with more of the hand in contact, turning over the area of the middle angle of the scapula to continue to the axilla. And second one is kneading. The finger pads are used on the posterior aspect from the occiput down where the neck widens, and then hands are flattened possibly and continued on the interscapular area. The third manipulation is picking up. Place one hand round the whole posterior aspect of the neck and perform a single-handed picking up manipulation, which can involve into simultaneous work done on the lower part of the upper fiber trapezius with one of our hand on each side of the neck. The fourth one is muscle rolling. The posterior column of neck muscle on each side may roll by placing the fingers just behind the transverse process in the thumb alongside the spinous process. The fifth one, hacking and clapping. Hacking and clapping may be performed on the neck alone, with the line of work starting near the occiput and proceeding to the lateral part of the shoulder. 2 lines may be used, one more lateral and one more posterior on the neck. So here comes the conclusion of today's topic. Anyone can benefit from therapeutic massage when it is done by fully qualified and competent practitioner. Massage is also applicable for people currently in treatment for medical conditions, people with disabilities, and expecting mothers, although further precautions that may have to be taken to protect the health of the patient. Those who are unsure about whether or not therapeutic massage is for them should consult thoroughly to find if there is any contraindications.